recording this session. It's doing now, fantastic. So hello and welcome back to session 5 in the Research Skills and Social Care seminar. So today we're going to be talking about presenting and assessing your findings. I'm on the right window. So last session we talked about evidence synthesis and how to do your analysis. Hopefully after last session you kind of understand what's meant by evidence synthesis and have an idea of what's needed for different types of synthesis. To understand how to start the coding and the practical steps in synthesis. Today we're going to talk about how to structure your final report. We're going to talk about what should be included in your final report and why. And we're going to talk about how you might be able to evaluate your own work and assess what you've written and how useful that is in the context of your work. So firstly, there are lots of different ways that you can present or share your research findings. The one you choose will vary depending on your target audience, on who you are hoping will be impacted by your findings. You might end up using multiple methods of presenting your findings, and most people end up with some kind of written report or article, which is what I will focus on today. However, you can do things like presentation, talks, do a video that you post online or a podcast or a poster, any way that gets the message across from your research to the target audience and the people you want to be aware of it, whatever works for you. You might remember this from session 3. I said that most people end up with some kind of written report, and these are roughly the sections that you need in your written report. Your background might be broken down into smaller parts that focus on specific context and information, but these will always be roughly the chunks that you need to separate your final report into. And for each section, there are certain things that need to be included. So we said last time that the abstract was the elevator pitch of your research, and this is what people use to decide if they should read more. So when you're writing your abstract, you need to make sure that it contains all of the important information, key terms and buzzwords related to your research. So for our research question that's listed at the top there, we need to make sure that we're including collaborative social care services in our abstract, as that's one of the key phrases and key terms in our research question. We need to make sure that older adults is in there and what the intention of the research is. The abstract should tell people what they will gain from reading this research. I would normally suggest writing this last, but that's just my personal preference. So your background should set the scene for your research. For our question, I would start by defining what I mean by collaborative working and why it is used in social care services. I might talk about the rise in multi-morbidity in older adults and how different clinical and social disciplines must work together to ensure older adults receive appropriate and coordinated care for their health and social care needs. That was a long sentence. I might then talk about how older adults being supported by collaborative services tend to have better healthcare outcomes. And I might go on to talk about established issues with collaborative working, such as information sharing systems or regulatory differences between organisational bodies. And then I would finish the section by explaining that understanding all of these contexts and mechanisms to support those collaborative services will help to mitigate the difficulties by identifying strategies. So what you're doing is you're setting the scene there and you're outlining all of the issues, problems and all of the things that are relevant to your question, and then bringing it back and explaining why your question will answer and help with those issues. Your methods should be the easy bit, it should be the recipe for your review, and that's what we've been doing up until this point is sort of outlining those methods. And then your findings should be written in a synthesized and critical way. Your discussion will tell the reader how your findings relate to previous or current literature, theory and practice, and then your conclusion is just a recap of the main points. So I said that your findings should be written in a synthesized and critical way, but this is much easier to say than it is to do. You want to talk about the literature you include in your review, but it's important to do this in the right way and in the right places. One of the traps that people often fall into is that they end up writing descriptively with their review findings rather than their review findings, rather than in a critical or synthesized way. So writing descriptively means just that. You are just describing information. You are informing your reader. You might list details or tell the reader what something is like or what's happened. You might state the methods used. And as a reader, when something's descriptive in research, you might find yourself reading and thinking, so what? What does this mean? Why is this important? Writing descriptively can be really useful sometimes, but when you are synthesizing evidence, you want to present it in a cohesive and synthesized way as a whole body rather than as separate chunks. So this could be an example of descriptive writing. You can see that the descriptions of each study are listed one after the other. Each study is presented independently. The methods are described along with other key information, and then the text will probably go on to report each study's findings. It's reciting information and assuming the reader understands why things like location and method are important. By writing in a descriptive way, the reader is going to need to do a lot of work to try and make sense of the information you're giving them. When writing in a synthesized way, you will be giving your reader the information, but also telling them what that information means. So you might like combine the information so it isn't separate points anymore, but a whole body of information. You might explain those connections and how different studies connect, how they differ, how they're similar, and present your findings around single ideas rather than single articles. So in this example text here, you can see that the studies are presented together rather than as a list. They're not discussed individually like in the previous text, but as a group. You might go on to say that the divergent findings could be explained by the difference in data collection methods. There's focus group and there's interviews, or in the geographical difference of France or the UK. And then you might persuade or argue why that could be a possible explanation. This way you're comparing and contrasting the literature and the findings and contextualizing them, and you're looking for similarities and differences and presenting them clearly. So in this way that you're connecting some of those dots for the reader, giving them a little bit less work to do. I should actually say critical writing. So when you're writing in a critical way, you're giving your reader the information, you're telling them what that means, and you're also telling them why you're giving it to them. You might tell the reader why details are important, tell them the significance, why you're telling them what research methods were involved, what does that mean? You might discuss the pros and cons and the strengths and weaknesses as you have interpreted them. You're persuading the reader on your position and your understanding of the literature. So there's an example text taken from the internet here. You can see that, like in the previous text, the studies and the literature was discussed sort of one after the other, and here they're discussed much more as concepts. You might want to, when you're writing critically, focus more on things like when something was released and what was happening in the world at the time and how that might impact on how that study was undertaken or interpreted. When you're writing critically, you want the reader to be thinking, of course, that makes sense, rather than I don't really get this. You want them to be following your train of thought. What can be really difficult though is actually working out how you write critically. And again, everyone will have their own process for this. Some people, particularly me, find it helpful to start with a descriptive, unsynthesized, non-critical paragraph and edit it from there. So if this is our descriptive paragraph that we've just written, because these are the descriptive details of the articles in our review, let's say that our review is about decision-making around going into residential care as an undergrad. We can read back through our descriptive paragraph and pick out the bits that need a little bit more information and a little bit more explanation. So we can think, well, why do we need to tell the reader that these studies were done in different locations, that one was in the UK and two were in France? Are there differences in the rules or regulations between France and the UK that might impact someone's decision to move into residential care? If there is, we can make a note of that. We can just put it to the side for the minute, but we've got that information there ready when we need it. Next, we can see that we describe the methods, but why does the reader need to know that one study conducted focus groups, whereas the other two conducted interviews? You might then start to think back to your critical appraisal of the literature you did at an earlier stage, and would these methods of data collection have impacted the accounts given by participants? Again, you can make a little note of that and put that to one side. Next, we've told the reader that there are different people involved in each study, senior managers, care staff, residents. We can make a note about what that might mean. We can also link this back to our methods. Would care staff feel that they can speak openly in a focus group with senior management? That might be a little piece of information that we can put to one side to use later when we're starting to bring it all together. So now when we look back at the information we've got quite descriptive information. Now we've got a bit of critical information in there as well. The next step, we just need to restructure our sentences and start to rebuild our paragraph. Writing in this way can be really, really difficult, and sometimes it can be hard. I often find myself with all these ideas in my head and I'm sort of hovering over the keyboard and nothing's happening. So the University of Manchester have developed a phrase bank of sentence starters and connectors to help you just get off the ground and help get those sentences started. This is a great resource and it can really help when you get stuck with writing. So clicking on all of these different headings brings up example sentence starters you can use, which can also help you think in a more critical and synthesized way. So you can see with these examples here with introducing differences, it's already starting to encourage you to present your information in a synthesized way by comparing and contrasting. All of these phrases are arranged depending on what they help you do, and you can explore these more by clicking through all these headings. So one of the things about writing up your findings is that for a lot of people, writing up are often the final part of your analysis. And I know this is true for me. Often when you start writing your findings, you have lots of ideas of conclusions that are really cloudy concepts or ideas that are just sort of out of reach and you can't quite define them. So I'm a knitter. I like to think when I'm at this stage of my analysis, my brain is just like a big pile of tangled yarn. All of these bits of information are mixed together. Like I don't know where one idea ends or another one begins. I don't know how they're connected. I've got all this descriptive information mixed up. And I know there's ideas in there, but they're all knotted together somewhere in the middle of the file. And I don't know how they connect to everything. So I like to start by writing out that descriptive information, like in the example descriptive text that we've shown in the last couple of slides. And then adding in my explanations and my sort of my little thoughts about different parts. And then preparing and contrasting that information in writing as a first draft, it really helps to organise and make sense of my thoughts. So I can see visually in front of me the differing views and findings of the studies. And it really helps to get them out of your head sometimes just to help make them a little bit clearer. And once you're there, you can start to knit them together. You can start to rewrite them again into a much more critical synthesized paragraph that starts to look at and articulate your concepts and your ideas. Obviously, this is a very iterative process. When you're assessing your writing and your paragraphs and your ideas, there's some questions you need to be asking yourself. And it's good to keep reviewing what you've written and keep asking these questions about your work. So while these specific questions refer to the full report you produce, and remember your findings won't have any meaning if they're not presented in some kind of context. You can use a couple of these to look at paragraphs from the previous page. So if we start with, are there any terms that need explaining? I think having looked at this paragraph, there's quite a few terms that need explaining here. I haven't said what study one meant by crisis point, other than it's something to do with being admitted to hospital. And as a reader, I'm looking at that and thinking, well, surely like whether or not it's a crisis point depends on why you're admitted to hospital. And there's lots of other factors that may or may not make that a crisis point. So that needs explaining. I haven't explained to the reader why identity and independence are important concepts related to decision making. This is just an assumption I've made in my head. And reading it back, I can see that actually that doesn't necessarily follow on because I've not explained that. This might be a really good opportunity to add in some information or a sentence or a paragraph, just explaining why that's relevant. I've also mentioned the needs of caregivers, but I've not said why that might be important or why it might impact decision making for an older adult. It isn't clear what I mean by managing a crisis point. Again, as a reader, I might look at this and question what it is about managing a crisis situation that's more important to an older adult and why. And again, I haven't explained why I think one needs a positive identity decision making. Perhaps on reflection, reading the article, reading what I've written, and thinking about those ideas, perhaps I'm not actually sure that it is relevant. And it's not important. I might need to go back and do some more reading and see what other people say to help clarify my thoughts. So you can see that overall in this paragraph, I'm making some leaps in logic and some assumptions that aren't explained to my reader. They might make sense and logically flow in my head, but that doesn't mean they make sense and logically flow on paper. Once I start to question what I've written as well, then perhaps I'm not even convinced myself. And once you start to interrogate those ideas, because they're written down out of your head, if you can't quite articulate them, you might find that maybe they don't really work as you thought. Additionally, in this paragraph, there's not a single mention of any methodological consideration. I know I need to consider that, so I would use these questions to go on to my next draft and start adding that information in. With each iteration, you're adding critical detail and analysis, which contributes to your final findings and gives them a bit more weight. One thing to consider in this paragraph is that I'm still not quite presenting the findings in a synthesized way. And in this example, I'm still providing a list of details really about specific articles rather than presenting them as a body of knowledge. And a key giveaway for this is the repeated study something found, study something found, study something found. It can be quite useful to look out for those little giveaways of how you're writing and what sort of writing. This sort of difficulty with synthesizing writing can be combated by presenting the evidence under a theme that connects the studies rather than describing what each study contributes to a specific concept. It might seem a small distinction, but it can really help develop your writing if you just change slightly how you think about it. If we're looking at assessing what you've written, something you can do is use the tools we discussed in session 3 to appraise your final report. We mentioned in session 3 how critical appraisal helps you decide how relevant or valid evidence is before you use it to inform a decision. And it can be really useful to then use these frameworks to assess your own work, especially if you're hoping they might contribute towards evidence-based practice in your area. So the QR code on screen would take you to the slides from session 3, but I'll put this back up at the end. Now we get on to the meaty bits. So there is a tool that looks at evidence you've produced, or rather looks at the body of evidence that you've used and how you've analysed it, rather than the individual studies like in the critical appraisal for tools we discussed last time. I absolutely do not have time to cover this tool in depth today, and I might not be able to so if we had it here, but I will try and give an overview. So this tool is called GRADE, and this stands for Grades of Recommendation, Assessment, Development and Evaluation. It's a tool that provides a systematic approach to grading the quality of the evidence you've produced in your review and helps you decide how much you can believe in your results. This version of the tool to use was quantitative methods and was developed by healthcare researchers and for use in guideline development, but it can also be used in social care research, particularly when they're evaluating things like quality of life or activities of daily living and more quantitative outcomes. So the tool uses 5 areas to grade the quality of evidence for each of your synthesized outcomes. These are risk of bias, which is already on the screen. This talks about the limitations of the studies that you've included. Then we have imprecision, And you might remember last session we talked about confidence intervals and that how these provide a range of plausible values of what the true effect you're trying to measure might be. If the confidence interval is very wide, then it's imprecise and there's a lot of uncertainty around the outcome that you're trying to measure. So if your review question might have been to understand the impact of different accommodation types for care leavers on the number of care experienced young adults who are not in education, employment or training or NEET, and the 95% confidence interval suggests that staying put arrangements in comparison to independent living have little to no effect on people who are not in employment or education for training, or may lead to small, medium or large reduction in care experience young adults who are NEET. That means that the confidence interval contains a really wide range of plausible values. It's very imprecise, so we're not really sure what the effect of staying put arrangements might have. And just to remind you guys, the examples I'm using here are completely made up. So the next domain that it assesses against is inconsistency. So if some studies suggest that staying put arrangements are better for who are not in employment, training or education, and others suggest it's worse, then these differences can't easily, be explained, then we have a problem with inconsistency in data. If you've included lots of studies in your review that all say different things about the same issue, then the level of this inconsistency reduces the confidence that we can have in your findings. Indirectness, so for example, using the previous question around accommodation types, if some of the evidence you included in the analysis only measured unemployment rates without considering those in education or training, but not the whole range of people who are not in education, employment or training, then it's not a direct measurement between those two groups. The findings may still be helpful, but they didn't directly answer the review question. So the certainty of the evidence is a little bit weaker. And then publication bias. So this talks about studies that produce how when studies produce negative results, they may not be published. This would mean that they're then not included in your review, even though they may have useful findings and provide some useful evidence. So then if only positive results are published and used in a review, the resulting review would be subject to publication bias because it wouldn't include the whole body of evidence that you're not able to obtain. You'll see down the right-hand side, there is a lot of recommended reading for this tool. There is one article for each of these areas, and these go on to explain these concepts in much more detail. There's also an entire website with an index of resources on this GRADE tool, which I will link to at the end, and hopefully you can see why we're not going through that in excruciating detail, because there's quite a lot. Essentially, when you're using this tool, you subtract points if there are any problems in the mentioned areas. And then there are also some special circumstances where you can add points. In the end, you come out with a quality level that indicates how confident we can be in those results. For qualitative work, GRADE have developed an adaptive tool. So much like the previous one, it assesses qualitative work based on specific areas. So this one's called CERQual. You can apply these criteria to each of your synthesized themes or main findings that you developed in your analysis. So the first domain is methodological considerations. And again, this is about the study limitations or whether there are concerns about the conduct of the studies or methods used, the ones that you've included. Coherence, which means essentially how much your findings make sense from the data you've included. So if you have all of your themes, what data you've included, one of your themes, how much does that theme directly relate to and make sense from the data that's included? The adequacy of data, which means about the richness and the depth and the quantity of data you use to support your findings. And the relevance, and this is whether your included studies are actually relevant to your review question and what you're hoping to achieve. And again, each of these domains have a paper written about them to aid in understanding, and they're all referenced in full to the site there. There is also a website, again, full of resources that I will link to. And again, once you've assessed your work against these domains, you'll come out with a level of confidence in your findings. These tools can really help you move from merely presenting your findings to informing interpretations and if appropriate, recommendations. For example, the data from quantitative studies, I don't know where that came from, quantitative studies may suggest that something is beneficial, but you need to interpret that information in the context of how trustworthy that evidence is. And if the studies are at high risk of bias, then you may actually be very uncertain about that positive finding. You might formulate a theme from your qualitative data around the impact of strength-based approaches on people's sense of empowerment, and your confidence in that finding might be influenced by the quality of the studies backing up that claim with rich data. So it's been a bit of a whistle-stop tour, actually. It's quite difficult to assess writing, assess your own analysis. And those tools that we just talked about can really help look at how much you can trust the findings that you're coming up. So hopefully this has given you a bit of an idea of how to structure your final report. You should be able to understand what should be included and why, and the type of the ways that you might need to present that with concise or writing. And you should understand what will go into evaluating your own work and how useful that can be for developing your analysis further. Next time will be our last session, which will be where I talk a bit more about how you disseminate those findings and how we can make sure your findings end up somewhere where they will make a difference. We always talk about research happening and then disappearing. And next time I'm going to talk a lot more about how we can make sure you get that research into the hands of people who want to read it. So when I pop these up, these links will be clicked through, but there's some links to the GRADE and GRADE CERQual resources. And then finally, there's the QR code again if you want to go back to the session 3 slides we talk about critical appraisal. And additionally, if you want to watch any of these catch up online, then just go to YouTube and type in research skills and social care and look for my lovely face. And other than that, guys, thank you very much for coming. I know that's been quite a whistle-stop tour and quite a quick one. I will let you go very much unless there's any questions. I'll just stop this recording.